Hello, everyone. My name is Jennifer Scott, and I am the current suspended registered nurse due to my vocalisation against puberty blockers, wrong sex hormones, and the trans agenda in New Zealand. A few weeks ago, I went and did an interview with Counterspin Media. Unfortunately, that interview has been taken away by the police. All their devices were taken, so that interview got taken with it. So unfortunately, we're having to go and I'm having to do it all over again myself. So I'm hoping today that I can share with everybody what we talked about in the interview. A lot of people in New Zealand are aware that there's conflict going on between the LGBTQ plus and the rainbow community, but you don't really know what's going on. So I'm hoping that this presentation will help people to understand just what's happening in New Zealand. I have worked as a registered nurse for around 8 years. I've also had a break in between. I've worked in general medical, surgical, pediatrics, and mental health. I've also done some work in rest homes, homeless shelters, and stuff like that. Currently, women or people or females in general who speak up about the trans stuff are being called TERFs, which is a transgender exclusionary radical feminist. So this is just anybody who knows that sex is real and that humans can't change sex. So they want to silence us to make all of this very normalized to keep it going. I would like to thank all the people who have helped me and supported me along the way with this stuff. Also the woman at Mana Wahine Korero and Hannah at Counterspin Media. So we'll crack on into the presentation and hopefully I won't miss out any stuff that I shared in the interview with Counterspin. So puberty blockers, they are an unrestricted drug in New Zealand. They're called GnRHAs, gonadotropin-releasing hormone that inhibits testosterone and estrogen from being produced in a developing child. They are not safe and fully reversible. They are experimental. It prevents bone and brain growth, and it is used to inhibit normal child and adolescent development. And they've also been used in precocious puberty for young children as well. In New Zealand, we have the gender affirming guidelines for gender affirming healthcare. These were made at the Waikato University and released by the Ministry of Health in 2018. So I came across this document in 2018, but it wasn't until the start of 2021 that I realised the significance that this document played in all of this. I've gone through this document and it has been modified and been made very simplistically from the original YPath guidelines. So the YPath guidelines are the standards of care, the World Professional Association for Transgender Health. So in New Zealand, this is what the healthcare professionals have on offer for them as the guidelines for gender affirming healthcare. So in the front cover of the book, there is lots of different terminology to teach us healthcare professionals, things such as non-binary, gender fluid, agender, gender dysphoria, social transition, pronouns, gender identity, gender diverse, and cis or cisgender, trans or transgender. So the cis or cisgender is another medical term for a person who's just born as the sex they are, really, where I'm a cis female. So throughout this document, they've done a really good job at making sure they've covered all aspects of someone's health: spiritual health, family health, physical health, and mental health. They've also done a good job at including the Maori culture into this document, which is a shame because Maori didn't have transgender people in their culture whatsoever. So throughout this document, there's a lot of red flags. There's a lot of things that stand out, such as statements of be knowledgeable about options such as binders or packers. So binders is the breast binders, or packers, which is a small, possibly knitted little device that is put into a girl's pants to make it look like she has a penis. So I have no idea why, as a healthcare professional or as a nurse, I would be wanting to know the options of binders or packers. They also have in this document, withholding gender-affirming treatment is not considered not a neutral option. So it's a one-way pathway that they've created. Also in this document, it says health teams need to be aware of the positive impact of puberty blockers and the need to refer promptly. There is no positive impact of puberty blockers. They stop a child's natural development, and the need to refer promptly is also a red flag, because a lot of detransitioners have spoken up and said that they're placed on this pathway really fast, and if they actually had adequate therapy and psychotherapy, then maybe a lot of their issues would have been resolved and they wouldn't gone down the path of medical transition. So Lupron is used in New Zealand along with a couple of other drugs as well. It continues to be fully funded for children and adolescents. So again, this is an unrestricted drug that impedes the child's ability to grow, and it's fully funded publicly. So why is this drug fully funded when there are other drugs out there, or other issues that children have and drugs that are needed for children and they're not able to access them? So also in this document, we have the effects of masculinizing hormones. So once a child is on puberty blockers, this might be from the age of 11, 12, 13, 14, 15. They might only be on them for a year or 2 years. There's no amount of time that they've said that someone can be on it. Then the next step is going on to wrong sex hormones. So the reason why I use the word wrong sex hormones instead of cross-sex hormones is because it's about the changing of language. And actually, it's not right and it's not healthy for a female to be taking testosterone or for a male to be taking estrogen. So it's actually a wrong sex hormone. So once a female has been on puberty blockers, then it may be sometime later that she will go on to testosterone. So the fact that on the Ministry of Health website says that they're safe and fully reversible is not true, because when we move on now to testosterone, this stuff is not reversible whatsoever. So we've got here facial, body and hair growth, reversibility, unlikely. Scalp hair loss, unlikely. Clitoral enlargement, unlikely, and vaginal atrophy, unlikely. So this is also some more stuff that's in this document. There has to be more ongoing investigations, a full blood count every 3 months in the first year. Then they've got to have other scans done as well, and looking out for other adverse effects. So by no means is this gender affirming care safe or fully reversible, and this sets up a child on a medicalized pathway for the rest of their life. So also in this document at the very end, there is the part where a child can sign with their clinician that they want to start hormone blockers, and then also I wish to start feminizing hormone therapy or masculizing hormone therapy. And again, another really big red flag is that there is nowhere for a parent or legal guardian to sign. So in the medical world, we have such thing called Gillett competence. Can a child make lifelong decisions regarding their health and well-being? Puberty blockers and cross-sex hormones create lifelong physical changes and lifelong patience. These drugs can sterilize healthy adolescent bodies, of which youth cannot foresee the lifelong consequences. So everybody is able to go onto the Ministry of Health website yourself, and you can look at this gender affirming healthcare document that's available to everyone, and that's what is being taught and is available to healthcare professionals in New Zealand. So throughout the world, internationally, all of this stuff is starting to be shut down. The Agency for Healthcare in Florida, Oxford University, Finland, Sweden, and in Australia, and recently in the UK. So in Sweden, the Karolinska Institute stopped giving puberty blockers to adolescents under 16, and the Institute cites uncertain and extensive adverse health consequences and the difficulties gaining informed consent. Recently in the UK, some will be aware that the Tavistock Clinic has been advised to close, and I'll talk a little bit more about that in a second. And then also in New Zealand and Australia, we had the Royal Australian New Zealand College of Psychiatrists, who last year also released a position statement stating a caution in this field. GenSpect, another international group, have released some more information about puberty blockers. Minors who were female suffered from symptoms of tumor-like masses in the brain, visual disturbances, headache or vomiting, swelling of the optic nerve, increased blood pressure, and eye paralysis. So definitely not safe or fully reversible whatsoever. So also throughout this document, there is lots of times when they've mentioned throughout it that these drugs, that the side effects, that they're not fully known, and that the long-term impacts are also not fully known as well. So my favorite research is that I looked into. My favorite ones was, one of them was from Lisa Lippman, about parents' reports of adolescents and young adults perceived to show signs of a rapid onset of gender dysphoria. So parents report a child presenting with new gender identity after being exposed to online internet content. Sites such as TikTok and Reddit have child influencers and groomers who seek to validate a child's confusion and self-hate, telling kids they must be born in the wrong body if they are confused or feeling discomfort about themselves. They also tell kids what to say to a clinician and how to get the drugs quickly. She also researched into social contagion, where a group of friends decide to all become trans together. And some other recent important research was in Australia, Australian children with adolescents with gender dysphoria, clinical presentations and challenges experienced by a multidisciplinary team and gender service. So this research showed that children who present to services with gender dysphoria have a wide range of mental health issues and may have conflicts within family structures. Most children who have gender identity confusion have high rates of autism and may grow up to be lesbian, gay, or bisexual. So this is kind of where the term has emerged from, don't trans the gay away. From my own experience, I also noticed a increase of presentations of youth with gender dysphoria to the mental health ward I worked on as well. And I agree with the research 100% that these children have some other mental health issues going on, and there may be some conflicts within family structures. So these are issues that have to be looked at 100% first. So in New Zealand, we also had the trans and non-binary people. They did their own survey called Counting Themselves. So thank you very much, because you helped me not have to do much more work and research this myself. So they've even said within their own research that neurodiversity is high amongst them, drug use, psychological distress, increased self-harm behaviours, and they may have also had some sexual abuse in their lives. And a highlighted comment in Counting Ourselves makes the strategy clear that a female who takes testosterone can then pass as being a male, so that she's not going to be sexually abused or sexually harassed. So that's in that document as well. Also in New Zealand, we have the report of a government inquiry into mental health and addiction that was published in 2018, where people talk about they want to have they want to have access to more talking therapies and a holistic approach rather than a reliance on pharmacology, and they want their mental distress responded to rather than acted upon with drugs. So again, I have no idea why we're going down such a very aggressive pathway for children and young adults who are struggling with loving themselves and accepting who they are, or they're possibly lesbian or gay. So breast binding is all a part of this as well, and which is being promoted. Breast binding has multiple negative physical complications. Long-term use can cause fracture of ribs and prevent adequate breathing. Inadequate use can cause bruising, scarring, and permanently damage breast tissue. And so I have a small case study for some medical professionals here. A young girl presents at ED who is lethargic and has a fever. On closer inspection, she is wearing a binder, which has now cut her flesh and is infected. Her breathing has also been impacted. So, as a healthcare professional, it is unacceptable to ignore this issue and show her how it should be done. She needs therapy to help her with her negative self-thoughts, not provided with affirmation of her dysphoria, which has led to her self-harm. Also, doctors, stop. So your diagnosis of F to M, which is female to male, is wrong. No child should have medical notes written with this language. It's called gender dysphoria. And I've seen that myself of 15-year-old girls who presented to services, and in your notes you've written she's transitioning from female to male. And that really annoyed me. So stop doing it, because it's not true, and it is detrimental to her and also her family. And what they're coming to services for is help with what's going on, not for you to use little language of F to M saying that she's in her transition. She's not. She has gender dysphoria. So binder or corset, what's the difference? Then we had the corsets, which again did a lot of damage to our internal organs, and now we have the binder. So what's the difference? The trans ideology is anti-woman and anti-feminist. So my next couple of slides are going to have some pictures of the surgeries that take place. So if people have young children watching right now, you might want to take them aside and not let them see the images until you've decided if you think they're appropriate for them to see. And then it's only a couple of slides anyway. So this is the double mastectomy of youth, relabeled as top surgery. All of this is in the name of inclusivity. This inclusivity promotes body dissociation, dysphoria, self-harm behaviours, and the removal of healthy body parts. So as we can see with the young girl on the left, she already has self-harm scars on herself. So as a healthcare professional, I have no idea why we would be supporting her to continue to self-harm. And for a lot of people out there, seeing these images is going to be really uncomfortable. And I acknowledge that completely, because when I first saw these pictures as well, it's uncomfortable stuff to look at. And this is why this type of practice, this isn't any type of medical practice, this is abuse. This needs to stop. So we also have now when a girl is being made to have a fake penis. So they take a skin graft from either the thigh or the forearm. These body parts are non-functional. They are just there for show. And of course, there can be surgical complications, and most likely a lot of the time there are, and also long-term complications as well. So if a young girl presented to services who was anorexic, we wouldn't provide her with liposuction and agree that she was overweight. So why are health professionals affirming a child's distress and dysphoria? So what we have going on internationally is a high rate of detransition, where young people have been placed on a medicalized pathway and then realized a couple of years later that, holy moly, what have I done? What's been done to me? And they're speaking out against all of this stuff. So one of the biggest people speaking out is Cara Bell, and she's an inspiration to me, and she should be an inspiration to so many other girls out there. She was placed on puberty blockers around the age of 15. She went on to taking cross-sex hormones and getting a double mastectomy. And it was in her early 20s that she realized that this isn't right, and she took the Tavistock Clinic to court. Currently in New Zealand, I'll talk about that going on in a second. So here we go. So breaking, the Tavistock Gender Clinic to close, neither safe nor viable. Britain's Tavistock Sex Change Clinic for Children closed after damning report, which is such great news. This only happened within the last couple of months. And also in America, the FDA slaps women on puberty blockers. So Dr. Levine, he also announced that, oh yes, there is some issues here with puberty blockers, but he didn't make the initial stand. He's been one of the last ones to do so. So, and yet amongst all of this, puberty blockers remain on the Ministry of Health website as safe and fully reversible. And I did look today, they still haven't changed that. Their page was last updated on the 11th of September 2020. So the Ministry of Health only provides links to affirmation, drugs and surgeries. So in the medical profession, young doctors and nurses are being taught the affirmation model. They're only being provided with what's on the Ministry of Health website, and that only has links to the affirmation model, when it's actually the watch for weight approach, which has been recognised internationally as the gold standard. In New Zealand, we have the Professional Association for Transgender Health. So this is the group of individuals, the group of doctors who are growing around and trying to do conferences, teaching young medical students and young healthcare professionals how to be a great gender affirmer. In New Zealand, because puberty blockers are an unrestricted drug, they are not in a specialist clinic. They can be prescribed by any prescribing clinician, and this is what is so dangerous. The OIAs that have been put out last year, some of them have come back from the DHBs. Our rates and numbers are high in New Zealand, and if this practice doesn't stop, our rates could exceed that of other countries. And that's going to be a really sad day for New Zealanders when all of this stops. So those OIAs are only from the DHBs, so we have no idea other GPs or other specialist clinics, family planning services or anything, if there's clinicians in there also charting these drugs as well. So this is some really dangerous stuff that is going on. So in New Zealand, the support that we have available against all of this, because like myself, there's a lot of other individuals that realize, holy crap, look at what is going on, and we need to inform people about this, and we need to stop it. So we have Resist Gender Education. That's a good place for teachers and parents to go to. We have fullyinformed.nz. That is a place for, again, parents, teachers, and healthcare professionals as well to go to. We have Speak Up for Women. We have Family First. We have Mana Wahine Korero, the LGB Alliance. We have Lesbian Action for Visibility in Aotearoa. We have Save Women Sports, and we also have CATA, the Child and Adolescent Therapist Association. So about 2 months ago, a couple of weeks ago, CATA they held a conference in Nelson talking about gender identity and gender ideology and its harmful impacts on young children. That conference was tried to be shut down by online complaints, online abuse. So in the end, the conference had to be moved to a secret location in order to protect the speakers who were going to that event and also the people who were attending that event. So this stuff is happening in New Zealand. We're being silenced, we're being cancelled, all in the name of some inclusivity that isn't actually true. So as well, as medical professionals, we have a duty of care and to first do no harm, the ethics of transgender healthcare, and watchful waiting for questioning kids works in psychotherapy. Everything else is malpractice. So some books that people can look up and have a read of. One for clinicians, which is one of my favorites, is Gender Dysphoria, Susan Evans and Marcus Evans. Marcus Evans was one of the clinicians who was working at the Tavistock Clinic. They have written a therapeutic model for working with children and adolescents and young adults with gender dysphoria, and there's some really great case studies in there. We have Helen Joyce, who has written the book called Trans, and Material Girls by Kathleen Stock. And there are many other women out there who have written some really great pieces about this issue. So also we have internationally, we have Transgender Trend, GenSpect, Coalition for Biological Reality, and Advocates Protecting Children. So once upon a time, parents kept their children far away from people who wanted to inject them with toxins or cut off parts of their body. And before the world lost its mind, no one is born in the wrong body. So I really hope this is, it's the end of my presentation. I really hope that I've been able to inform some of you guys more about what's going on in New Zealand, that currently the Ministry of Health still has advertised on its website that puberty blockers are safe and fully reversible. There is no scientific evidence, there is no research that backs it up. Internationally, the clinicians and the clinics that were using these experimental drugs have been shut down or ordered to shut down. So it's time that New Zealand does the same thing. So this is my first presentation to let you know about the puberty blockers, wrong sex hormones, and the trans agenda. And my next one is going to be talking more about falling further down the rabbit hole and the policies and the legislation and the documentation that is being made and changed in order for this type of practice to occur. So I thank you all for listening in. Please share it. Please go away and do some more research yourself. There's plenty out there on the internet. There's plenty of detransitioners out there that are saying, please stop this stuff. It is horrific what has been done to them. And I really hope that you've learnt something today. Thank you, and look forward to seeing you watching my next presentation.